Hello, my name is Julie Kosterniuk and I'm a research associate with the Rural Dementia Action Research Team. In this poster, I will be presenting on an ongoing research study on the RaDAR memory clinics currently running in primary care practices in rural Saskatchewan. As we know, specialized care and community resources are not easily accessible for people living in rural and remote areas. To ensure we meet the needs of rural older adults living with dementia, primary care professionals should receive the necessary resources and training. The purpose of the study is to adapt, spread, and sustain one-day rural memory clinics in collaboration with rural primary health care teams in Saskatchewan. We use a community-based research approach for this ongoing intervention study, which is supported by a dementia working group made up of directors and managers with the Saskatchewan Health Authority, as well as healthcare professionals and the Alzheimer's Society. A central feature of the memory clinics is the rural primary health care model for dementia, shown here in the figure with the three colored gears. This model was developed by our team based on best practices in primary care for people living with dementia. We worked closely with one primary care team at a time to operationalize the model into one-day memory clinics in their practices. One-day memory clinics are held every 1 to 2 months in each community, with 2 new patients seen each day. Current locations include Kipling, Weyburn, Rural West, Carlisle, and Merrifield, all in southeast Saskatchewan, and you can see pictures of the 5 teams in the green box here. The interprofessional memory clinic team includes a family physician, nurse practitioner, home care nurse or social worker, occupational and physical therapists, and an Alzheimer's Society First Link coordinator. Some teams also have a dietitian or pharmacist involved. The format of the clinic has been adapted and tailored for each team since they may have different configurations of professionals and different local services and supports to offer. The memory clinic appointment begins with a brief team huddle, followed by a meeting with the patient and the family to discuss concerns and review the appointment plan. The patient is then assessed separately with each team member, and at the end of the appointment, the team has a quick debrief and then meets with the patient and family to discuss recommendations and care plan. For decision support tools, we have incorporated and adapted the Primary Care Dementia Assessment, Treatment, and Algorithm, or PC Data for short. PC Data was developed by Dr. Dallas Seitz at the University of Calgary. The EMR flow sheets are available to all of the memory clinic teams through both the MedAccess and the Accuro systems. And each team member has a separate section in the flow sheet that helps guide their assessment. And you can see the screenshots of the flow sheets in the green box to the far right. Specialist to provider support is available to teams, which includes PC Data education with Dr. Seitz, as well as continuing education webinars on topics identified by the teams and virtual assessment and interventions for patients and families delivered by the Specialist Rural and Remote Memory Clinic in Saskatoon. We have a number of research projects related to the clinics underway, and our project reports and publications can be found on the RaDAR website. If you would like to see a short video of the Kipling Memory Clinic, be sure to use the QR code here on the poster, and this will take you to a short YouTube video. We are continuing to expand, and we look forward to bringing the clinics to more communities in the near future. Thanks very much for your time, and I hope you enjoy taking part in Summit.